But since I've known her, she's always been that person. Like you call and she doesn't say no. You know. And she's going on to do great things, and she's going to tell us all about it. What's up, Anna?
Hey. Hey guys,
How
thank
we
you for
doing?
having me today. I'm super excited to be here with you guys.
Yeah.
This has been an amazing journey for as long as we've been working with the redemption crew, and you guys have been significant in my life as well.
Okay. So what's going on?
Well, so much is going on. Let's just say, new grandma. How about that?
New grandma.
A new grandma. Yeah.
Not the first time?
Well, no, not the first. Second time.
Second time.
So I have a boy and a girl now.
Okay.
Yeah.
What's the little baby's name?
Jasenia. So I call her Jessie for short. So I'm super excited about starting a new journey with her and my grandson Giovanni.
Jasenia is a Gemini.
She is.
I'm a Gemini.
Is she? Yes. 28.
So we're some crazy ass people. But we're good people.
Yeah.
Crazy ass people, can't stop. I mean, we go a million miles a minute, high energy, but I think Geminis do a lot of good in the world.
Yeah.
You know?
Yeah. And I'm sure she will. I'm
Yeah.
going to be blessed to meet her this weekend, so I'm super excited.
When did you get the call?
So it was kind of like a pre-planned. She was induced on the 28th of May. So super excited. Get to go out there this weekend. I'm sad that they live so far away, but you know.
Where do they live?
Out in Jersey, but the far
Not
part
too
of
far.
Jersey, like 4 hours.
Oh yeah, down by. We used to go to Jersey Shore.
Yeah, I think they're just a couple hours in from that, but by Lawrenceville, by Rider University.
And is it your son or your daughter?
My son and his wife, and I'm super excited for them.
Yeah.
They've been great parents.
Is this their first one or their second one?
Their second. So,
okay, so
Giovanni will be 3 in a couple of weeks.
And Jasenia?
Jasenia, yeah.
Wow, what a beautiful name. They like the G's, huh?
Actually, J's.
J. Okay.
Everything starts.
Giovanni
is spelled with a J. J-I-O.
Oh,
yeah,
okay.
they call him Gio for short. And
Gio.
Then gonna call Jasenia Jessie for short. So super excited.
What time did you get the call?
About 2:00 in the afternoon. I was at work. It's like baby was born. I'm like, okay, I'm super excited.
Yeah. Did you do FaceTime?
Yeah, right away. Like they, as soon as they got settled, they're like, we're gonna, FaceTime you. So I got to meet her, and she's so beautiful, and
wow.
Yeah, she came out looking like my mom. So,
congratulations.
Yeah, super excited about that. So. But the reason why I'm here is to tell you about a great treatment center that's opening, that we opened in March, and really helping.
Peaceful Minds?
Peaceful Minds Treatment Center, located in Waterbury.
Yeah. What do you guys do there? Like, what's your primary... what's your mission? What's your mission there?
Okay, so much like you, my story began because I lost 2 people to overdose. My former husband and my little brother to an overdose.
Okay.
And many friends and many people came after that as well. And through the journey, I just felt like I had to make a change. And how do I make a change? And I see all the people going and getting the Band-Aid put on down at the methadone clinic and stuff. But, nobody wakes up and says, today I'm going to be an addict. It's deeper than that. So, my mission is to dig deep and to really try to heal what's causing them to use. To what's causing them to turn to substances that are not healthy for them.
I like that. Dig deep.
Dig deep instead of just putting the Band-Aid on the surface, right?
Medicate them and send them on their way.
Right. And
with no type of recovery plan in place.
No plan. And I noticed that a lot of people end up relapsing because, they go in, they're like, oh, I want to get sober, and they, from their substance, and they go in to get the Band-Aid, whether it's methadone or whatever, and they always end up relapsing. They relapse.
Yeah.
But so there's something deeper and darker
Okay.
in there.
So before we get deeper and darker into what your business, so tell us about, how does one get a hold of you, where you're located, what's the best way to contact you?
Sure. So we are located at 1389 West Main Street in Waterbury, Connecticut, which everybody's pretty familiar with because it's a big medical building
Are you near
Waterbury.
Seacar in Waterbury?
Seacar is down the road from
Okay.
us, and we do a lot of work with them as well.
Okay.
So we're up there on West Main Street. They could give us a call. There's a couple numbers. We have a 24-hour number. It's 203-800-1642. And although it may not be answered all the time, you can text it at any time and someone will get back to you very
That's awesome.
quickly. So that's 24 hours, 7 days a week, 365. Then you can call the office number at 475-689-3381. You can email us at P as in Paul, M as in Mary, treatment@gmail.com.
Okay.
And we have a
great.
little Facebook group, and we're working on it. We're building as we go, so we'll get there.
Yeah.
But just helping the community and really reaching out and not put the Band-Aid on the problem, but dig down deep. And so we started this treatment center, and a lot of people, as you know, they have PTSD, stress, childhood trauma, all kinds of things that really turn this, get them into their addiction. So we started treating patients for their mental health conditions with medication called esketamine, made from Johnson & Johnson, marketed as Spravato. And I gotta say that the people that we have been treated, some people see change right after their first treatment, and then some it takes a week or two. But if you're committed to the process, the medication has been known to be 98% effective, and that's a high number. And then we also have healthier options than the methadone. We can get them on some Brixadi and some Sublocade, some Vivitrol, depending on what medication matches their needs. And what that is a buprenorphine 30-day injection. It lasts between 28 and 30 days, depending on the person, of course. And we just adjust it accordingly. And they're not running back and forth to the methadone clinic every day for dosing.
Do you guys facilitate that detox?
We are working with the MSL from the maker, and we are working on how we have a pattern to transition them from the methadone to the Brixadi.
Yeah.
So and again, no pattern, just like the recovery journey, nobody's the same.
And what is the Brixadi again?
It's a buprenorphine injection.
Okay. So Sublocade.
Buprenorphine. It's just a different maker
Version of it. Okay.
And different way it's injected and that kind of thing. So we're super excited
it's
about
just
it.
The way it does the same thing, but it's just the way it's administered.
Right. And how can I say this? I don't want to go scientifically terms with you. I want to keep it very basic so people can understand. Depending on your drug of choice, depending on your usage amount, is going to be, my APRN, Greta Lewis, who's amazing and wonderful and helps through this process of being the prescriber at our facility. That's going to determine what medication that she puts you on and how we transition you. And it's a triangle effect with working with the science liaison of the medication to get you where you need to be in a comfortable state.
How do you guys evaluate that?
It's difficult because first off, you have to be committed to this process. You have to want it more for yourself than we want it for you. And with that commitment...
Absolutely.
Right. With that commitment comes the truth of how much you use. What are you using? Is it your mind or your body that's controlling the use? Are you thinking, I gotta use, or is your body craving the use, So it depends on the person and their story. And then we have to just do by a scale. There's a scale, of course, milligrams versus this, and so it's a complicated process, but we can and we get it done, and we do also. The S-ketamine is known to suppress the want of using substances as well. So together, it's S-ketamine. It's a nasal spray, marketed as Bravado through Johnson & Johnson. And together with those, the formula that we create for you, we pray that recovery is easier in the medication process versus not,
So you guys treat them medically. What kind
Correct.
of recovery resources do you have in place?
So we partner up with CCAR. We have Solidarity Counseling. All our
What kind
clients,
of counseling? Solidarity?
It's called Solidarity Counseling. They're a counseling group down the road from us.
Okay.
And we have like a triangle thing where we work with their PCPs. We send them for therapy. And then they come and see us as well. And then whoever else is in their dynamic, because everybody has somebody that they're working with.
Mm-hmm.
So we work very closely with everybody on your case, and we manage you appropriately to your need, because not everybody is the same, as you know.
And like you said something that's important. Somebody's recovery is up to them. It's not up to us. And if we want it more than they do, Anna, you know what happens. So what do you do with a situation like that? Like somebody's coming and you could see the telltale signs of when somebody's in recovery and they're thriving. Because when you're in recovery and you're working recovery and you're taking your medications, you're doing your therapy, you're being honest with self, you start taking good care. That's a win.
Right.
You know what I mean?
That's a win.
But
Absolutely.
what about the person that is just still struggling and they're coming to the clinic and not telling the truth, and you give them a urine and it's dirty? How do you handle those?
So, again, we have like detox centers and places that we've partnered with, and we try to just get them right back on the right track, because we can't, we're hoping that, with the Brixadi and the Sublocade, that blocks the receptors. So if you choose to use, you're wasting your money, because you're not going to get that, that high that you're looking for. So, if you come to us and we can tell that you're not so serious about your recovery, we're definitely gonna, offer you, like, let's come up with another plan, because this isn't working for you. So again, that plan is going to be tailored to that individual.
Yeah.
And do we go into an inpatient detox? How does it work for them? So again, we have the connections for the detox centers, and we have you guys that we use for when they have no place to live and they're in their recovery and they're in transitional housing or wherever. So we reach out and we just place them appropriately, and we'll know if they're serious about their recovery, because they'll go willingly.
Yeah.
You know what I'm saying? And that makes a difference. Now, listen, and it's sad to say, we just can't, if you're not serious about your recovery, then we can only do so much, right? Because we can't drag you into the appointments.
Yeah.
We can't drag you over to the detox center. We can't drag you into a new environment to help you out. You have to want to do it, and as long as you want to do it, we have the connections, and we're going to be here for you, and we pray that it's going to be great, experience for you.
Yeah. So how long have you guys been open?
So we started treating patients. We started intaking patients on the 25th of February, and we started treating patients on March 1st. So
this year?
Yeah, just recently.
Wow.
So it's new.
They're in the infant stage of their business.
We are.
I'll tell you something, right? As a business owner, there's a guy named Tony Robbins,
Yeah, I
motivational
do see him.
speaker.
Yep, on Facebook I do see him.
So he does a seminar. It's a 5-day seminar.
Mm-hmm.
Costs some money, but you go there and you learn a lot about yourself. But you learn how to run a business and the stages of business, and how to read the books. And it's just an amazing. And you do a lot of self-growth work on yourself. Like, they got you jumping up and down, and doing all kind of, but it's an amazing experience and it's an investment in your
I'll have to
business
look
and
into
in
it.
yourself. Yeah.
I'll have to look into that. Yeah,
Yeah.
Thank you, because
So-
you know, when you first get up and running, you're like, okay, we're gonna do this, we're gonna run this way and that way. But I did have a really good, solid business plan in place prior to this, and we're just, taking it one day at a time, and we'll
Yeah.
grow, and we're gonna learn. You
Yeah.
know? That's part of the experience.
Yeah.
But I guess the overall picture for us is how many people can we help in the community? Waterbury is a much needed inundated area
What kind
well
of
as
insurance do you take?
everything from Medicaid to United Healthcare, Aetna, Blue Cross and Blue Shield, Medicare, Humana, all the Connecticut state approved insurances.
That's awesome. That's awesome.
And,
So, what's the biggest thing you've learned about yourself working with this population so closely?
that everybody knows somebody.
Everybody knows somebody. You want to elaborate a little bit?
Yeah, so the people, people that have reached out to me over time, and my journey just really didn't start with this treatment center. As you know, I worked with you and Tony
Yeah.
Morrison from Brian
Redemption
Cody's.
House.
Yeah,
You were a big part of the Redemption House. We used to go to rallies together, and we got to know each other. You used to come in and work with the men and the women.
I chased a couple of your clients around town, and that's when I learned that if they don't want it, in the middle of the night.
Who'd you chase around
I
town?
can't tell you.
You can't tell
I
me?
can't tell you here, but
Okay.
Okay. Yeah.
Yeah.
There was a couple people that
Yeah.
we prayed for more for them, but they didn't want it for themselves.
Yeah.
And there was a few nights that I spent out circling New Haven, and yeah. But I learned that quickly. That if they don't want it for themselves, it doesn't matter what time of the hour you stay out to in the middle of the night, no matter what you bring them, no matter what you do for them, they have to want it. They have to want it as much as you want it for them. So I've learned that through this process of working with you guys, working with Tony Morrison, the king over there at Brian Cody's Brothers and Sisters Foundation, and now evolving into this treatment center.
Wow. Tremendous. I'm very proud of you. You should be very proud of yourself. I mean, I was blown away when you told me Peaceful Mind Treatment Center. I was like, wow. So your butt better be at our next collaboration day.
Yes. So I went in and out of being sick for the last couple of weeks, and it was terrible. I had to. It just was. It was
physically sick.
Yeah, like COVID, strep throat, flu.
Okay.
Yeah.
So let me ask you this question. Because I know in this field, a lot of people get burnt out. You know why they get burnt out, Anna? Because they stop taking care of themselves, or they never took care of themselves. But self-care is so important because that's your foundation.
Mm-hmm.
So if, somebody like me, I wake up early. Today I did a cold plunge. I worked out. I prayed. I meditated. I read.
Mm-hmm.
You know what I mean? I went and did practice with my boys, got back home, and, just ate some good food.
Yes.
Drank a lot of good. I drink filtered water, reverse osmosis water. And I'm really into self-care.
Yes.
And there's a place I could send you to that. It's unbelievable.
I saw you going into some place, and I'm like,
you saw us?
Yeah. I said, how's he got time for all the things he does?
Did you?
Cryotherapy? That's the only thing.
Cryotherapy. Yeah, we tried it. But I do a cold plunge.
I know. I saw that too.
Yeah.
No, I think I
Yeah.
don't want to do the cold plunge because I had a back surgery where I have titanium in my back, and if that sucker gets cold, I'm cold for like a week. Yeah,
okay.
So I'm I'm the opposite. I'm like, wrap me up in heating blankets.
Well, we have an infrared sauna too, which is very good for you.
Yes, I'm gonna need that.
Yeah. So you got to find what works for you. If you physically can't do something, you don't do it. But The
Yeah.
point is if you take really good care of yourself, it's going to show up in other areas of your life, like your personal life, like your relationships with family. You know what I mean? And in your business. You know what I mean?
Absolutely.
Because I mean, people get so burnt out in this field, and I'm guilty of it. You know what I mean?
Right.
And that's why, I'm always like self-care. You got to take really, really good care of yourself.
Yeah.
So.
So, and just to mention to that, so I get up at 4:00 every morning. I get up at 4:00 every morning. I get my husband out the door to work, and then that's my time where I do like my prayer time.
Oh, so you're doing good stuff.
Walking my dogs is therapy for me.
Are you still near the water? You're still near?
I'm not. Actually, I just moved this past weekend. Me and my husband purchased a condo, and we renovated it for 7 weeks. So we're just getting in and starting to get comfortable, and I'm finding a new pattern of healthcare for myself. And that is like really taking the time. It's a nice wooded area, so when I walk the dogs, it's nice and quiet.
There's your time. So those are your morning rituals. Do you do those things?
Every morning. Every morning. So, and like I was telling my husband, we were just having this conversation. It's like, Rick, recently my mom passed away, and she was my everything.
Yeah.
I took care of her daily. She lived with me at my other house, and she passed away there, and I had a really hard time, like, pulling myself together, and I had the center opening in the meantime. She passed in January, and we were slated to open. We were doing the build out, so a lot of emotions went into to everything in a whole. So when we decided, like, I couldn't heal at that house, part of my own self-care was like going to my husband and telling him really how I felt. Like, listen, we need to make a move, and I did, and I was proud of myself, because I think a lot of people, when they're in the grieving, they don't realize that's like a recovery process in itself. So I always say that recovery process, not only from substances, there's a lot of recovery processes excuse me, that people go through that they don't really realize about it, and grieving is one as well, and it takes a real tax toll on your mental health. And when you can't do the right thing and be self-aware of that, that's when you're in danger of becoming an addict and getting on substances that you really don't need, because you're looking for an avenue, an out, instead of really getting to the core. So I went to my husband. I said, listen, I think it's time I need to make a move. I can't heal here, because when I come downstairs every morning, the first thing I'm doing, I'm looking for my mom. In the morning, I had a ritual with her. We used to have our coffee together, and I used to wash her up and get her ready for the day, and before I left for work myself. And that was no longer there for me. So by being very upfront and honest to him about, I need to make this change. And he was very on board and very understanding. And we did. We made the change. And I said, I see the difference, because it was very taxing for me, mentally and physically.
So now you got a fresh start.
Yeah. So now it's a new leaf. So I can feel the difference already, just being over there, just kind of like where our stuff is like moved in, even though we're still under slight construction.
I get it. Moving sucks.
Does it?
Sucks. And then you got to fix the place up. And once you start fixing the place up, you start painting and stuff, then you find more stuff, and it's like...
Well, what we did is when we purchased the place, we pulled out everything. All the flooring, all
you guys did?
Yeah, we pulled everything out.
Well,
I had my best friend's brother came, and we pulled out everything, all the cabinets, all the appliances, vanities, sinks, toilets, flooring, pulled everything out. And we just started. That's when we ordered the kitchen. We ordered, like, the day we closed, that afternoon we started pulling everything out. And it made it easier, but it made it tougher, because, you go into the, oh my God, this happened in the middle and it stalls this, or a lot of things were on back order. But it came together. God has really saw us through that process, and we're just waiting. We're just waiting for to finish getting the paint on the walls. We're almost there. So we're almost there.
Good for you. Good for you. So, what was it like? Spending those last days with Mom. Was she at home with hospice, or she had to go to hospice?
Yeah. So.
Are you okay to talk about it?
Oh yeah, absolutely.
Yeah, okay.
It's actually it's part of my healing process. So Mom came to live with me, back in February of last year, and she started to decline very quickly. So when November came, she was going in and out of this phase where she wasn't responding for days at a time. And then she'd pop back up like, I'm here, and where have you been, So December came, and they were telling me, that it's coming to an end, and you need to prepare. And how do you prepare? You just can't prepare. You know what I'm saying? So you say you're ready. But
celebrate the holiday, like we're going to have a nice Christmas.
Yeah, well, we had Christmas Eve dinner, and my mom was great, and she was excited, and, I made her favorite meal, and it was awesome. And the next day it came, and she wasn't feeling well. Wow. It happened that quick. And,
did she know what was going on?
Yeah, she did.
Okay.
She had congestive heart failure and kidney failure. So that next day, I took her. I took her into the 26th. I took her down to the hospital. And they said, she had, the infection was so bad.
December 26th?
Yeah. And I said, they said that this was it. So I was going to, I had talked to my husband, like, oh my God, I don't know how I'll do if my mom passes in the house, And he said, like, you just need to bring her home. So when I went to go see her at the hospital, they were getting ready to put her upstairs in with, like, the hospice care center. She was already part of hospice care. And she just looked at me, and she was looking for her son-in-law because she really adored my husband. And she said, I just want to go home. So at that point, I said, okay. And I told the nurse, and they transported her home. And, by the 28th, she had slipped into a non-conscious state. Her last words she spoke to me was that she loved me. That was the last words that she spoke.
That question was coming.
Yeah. Yeah. So the night before, my husband was sitting with her, and she said, tall man, she called him, I just want some coffee. So we made her like 2 cups of coffee. And she said to him when we were getting ready to go to bed, she's like, you're just so... you're beautiful, and she's talking to him, and she says that, but you're about to have your hands full.
Meaning you got to take care of Anna now?
Yeah.
Yeah, Mom's not going to be here.
Yeah, so, but me and my mom always really had a close relationship. We, had our struggles, but we really had a close relationship. I've always taken care of. She was not always a well woman. And, and she had said to him, I love you. You have your hands full. The next thing came, she really slipped out. And the next night, and it was on the 30th, and I said to her, this was the last time she spoke. And I was rubbing her forehead, and I said, I'm going to go to bed, and I want you to rest well. And she said, I love you. And I gave her a kiss, and that was the last words she spoke. And she died on January 1st.
She died January 1st?
Yeah.
My mom passed away on January 1st.
Not this year, right?
No, 1993.
Yeah.
She passed.
Yeah, so, it was not a good way to start the new year, right? You would think, but it was like, okay, what does this new year bring for me? Because this happens smack dab on New Year's Day, right? But I have to say, God knows what He's doing.
What do you think? Mom's up there watching over you?
Yeah, she
hooting and hollering, seeing all the wins you.
Yeah, she was excited for the center. I had actually ordered a extra chair for her to put in my office so she'd come in and watch her game shows with me during the day. She was on mobile, so she would always have to be, mobilely moved and then put in some kind of recliner or hospital bed. But I was like, she said, what am I going to do? We always used to joke. She said, what am I going to do? I want to come to work at your office. I said, what are you going to do? She said, I'm going to answer the phone. I said, what are you going to say? She says, you're calling my daughter's office. What do you want? With her
Is that how
New
she
York
talked?
accent. Yeah, she had a very strong New York accent.
She was born in New York?
Yeah.
You guys aren't Yankee fans, are you? Mets? Yankees?
Listen,
Okay.
I'm not a baseball
Yeah,
fan.
but you're from New York.
I know. So my grandparent, her dad and stuff, they were Mets fans. My dad and stuff were Yankee fans, but we're New York Jet fans. We're Jets. My boys are all Giant fans, but I'm a Jet fan.
Your son?
Yeah, my son and my daughters, both of them. They're all Giants and Giants fans, and I'm the only Jet fan. My dad was a Jet fan. So.
Yeah, misery doesn't love company, huh? Well, what's worse, being a Jets fan or a Giants fan?
Well,
I
guess being a Jets fan, a Redskin.
I'm a Redskins
fan. But
fan.
now Washington, they call them Washington, right?
Washington, they're the Washington Redskins
for life, right?
This is proof.
Right, that's proof.
This is proof.
And again, you are what you are when.
Yeah. I have a picture of John Riggins. I don't know if you remember him. The Diesel, they used to call him the Diesel. He's a running back for the Redskins. Badass dude. He just used to run people over. But let me ask you this.
Yeah.
Tell me the most amazing memory of your mom. Funny story, anything.
So this is what we laugh about all the time. Well, I have a little OCD, so I vacuum all the time. And my mom hated the sound of a vacuum. So before she came to live with me, like how often did they vacuum her house? I don't know, but I vacuumed 3 times a day. So every time I used to turn on, the vacuum, she'd be like, oh, turn that off. She didn't want to hear the vacuum, So she said to my husband, she said, listen, when I die and there's leftover, life insurance money, she used to say, can you buy my daughter a vacuum that makes no noise? So that's
that was the running joke.
Yeah, that's the running joke. But every time I turn on the vacuum now, I hear her, screaming in my mind, like, turn that vacuum off,
Yeah.
And
brings a smile to your face.
Yeah. So
bittersweet tears.
Bittersweet tears.
Yeah.
And, I miss my mom every day. But
what's the biggest thing your mom taught you about life?
That no matter what you go through, you're strong, and you need to pick up. And we always used to have this famous thing, like when people like get on your nerves or really try to down you or work your nerves, and start talking to you. We always, me, her, and her brother, which was my godfather, don't take the bait, because people fish and they fish, when they fish and they fish, but don't take the bait. Keep going. And I know my mom's looking down, and she said, even though I passed at the time that I passed, and she was in the middle of doing all these things, she never, never stopped. She would just tell me, you're the strong one, and she'd say to me, I know you'd always be the one to take care of me to my last day. And it was true. I held her in her last breath, and I always say she held me in my first, and I held her in her last. And I have tons of great memories. I have tons. Those are the ones I pick up that make me thrive every day, And I'm gonna stay on this journey to help the community, because that's how my mom saw me. She knew that, after my significant loss and so on, that's my passion. My passion is to see people like recover from, whatever substance they chose, or from their mental health issues. It's important to me.
What was your brother's name again?
Jeremy.
Jeremy.
Mm-hmm.
You want to talk a little bit about Jeremy?
Sure.
Jeremy or Jeremy?
Jeremy.
Jeremy.
Yeah.
Okay.
Jeremy was 23 years old. My dad had remarried a woman who had a few kids, and he was the baby of the bunch. And we were very close. He'd come up to Connecticut, visit me and my kids all the time. I bought him his first car. He ran into situations where he started running with the wrong crowd, and ended up using. And at the time, he was really sick. He had like pneumonia, bronchitis, something bad where he was on like other medications, but then he was using too. And he caught a bad batch. And the combination of all the stuff he was on from the doctor and what he was using on the street, they found him unconscious on December 19th. And he ended up passing that day too. So, you know, it was hard. It was hard. I knew nothing about. He was 23 years old.
So he
was a baby to me. You know,
yeah.
23 years old, and I didn't. That's when I really learned about. You know, I wasn't just a parent that was like, oh, drugs. I don't want drugs. I don't want to think about drugs. You know, that situation forced me to learn about things that I never thought I needed to know. And then it went into, I need to help, and then I'm trying to raise kids. And then my former husband, as you know, he was in recovery for many years, and he had a relapse, and he died of an overdose. And that was the icing on the cake, and that was it. It's like, no, I cannot see another person I love or anybody I know I could see or touch die from this. This is a disease. I had to learn that. I always thought that like drugs was a choice. Like, oh, you know, I didn't know. I had to learn. This was a journey, a learning experience for me, you know. And I also learned that you don't know what somebody's going through that causes them to use. And it's not a choice. This is a disease. And once I learned that, my perspective on this was crazy. Like, I have to change the world. I wanted to go into the phone booth. Remember Wonder Woman? Just go into the phone booth and come out. Yeah, exactly.
Yeah.
And that's how I felt. And I was able to partner up with some great people, such as yourself and Tony and Chaz, Carmen from Isa B from Waterbury, in New Haven they have, and some really amazing people. Karen Tyson, Karen of Blonde, lots of people that I met through this that really empowered and encouraged me. Dana Giordano out of Brantford, she was the one that really was a powerful force for me.
You know Pastor Dana in New Britain?
I don't.
You guys should connect. I'll give you his number.
Okay, perfect.
Yeah.
So through all of you guys that I connected with on the learning journey, I mean, the journey of learning this never stops, but how you guys encouraged and empowered me to keep going forward. And when I went and took all the C-card classes, became the certified recovery coach, and then licensed it changed my life so that I could change other people's lives. And it's just up from now. You know what I'm saying? I'm not going to stop. I need to help as many people in the community. Already in the thoughts of expanding the treatment center to the other side of the hallway for more treatment room, bringing on more APRNs. So
awesome.
Yeah,
awesome.
I just want to keep helping everybody that we can.
So where were you at the moment that you decided you were going to open up Peaceful Minds Treatment Center? Where were you at? What were you doing?
I was actually working at a treatment center in Brantford, Dana Giordano. And I was watching her treat these patients. We were treating these patients together. And, I said, and it's in Brantford, so I'm driving an hour and 15 minutes in the morning to get to work. And probably a couple hours in the afternoon to get home, because you know how the highway is.
Where do you live now?
I'm in Waterbury.
Oh, okay.
Yeah,
okay.
So I'm traveling, and said, Waterbury needs it so bad. It really does. I feel like there's just not enough here. Like, I know when I come to the shoreline area, I could think of 4 people off the top of my head that have sober homes, recovery houses, for women and men. When I go to Waterbury, I can think of maybe 2 people, right? And then when you look at the list on the Spravato locator, excuse me, there's not a center within 30 miles of Waterbury. They have some like Waterbury Hospital, but it's not a center. It's like a hospital setting,
Yeah.
And I wanted something comfortable.
Churn and burn.
Right. And everybody will tell you, our patients and clients will tell you, like, when you come into our center, we're family.
Yeah.
We're family. You're not just a number. You're not a client file. You're not just a patient. You're family.
So what happens when they come in?
So they come in and we do an intake and we speak with them. We learn about them. And it's not a 5-minute intake. Sometimes
It's not a rush process.
Right.
It's like
Sometimes you're there for a
you
couple
want to
hours.
dig deep. You want to know.
We
what,
know everything.
Yeah.
They meet with the APRN, and then after they meet with her, they come and they meet with me. And then we come up with, and that's when I dig down really deep. So tell me this and tell me that, and what do you see for you? What do you want for you? How would you like this to work out? What do you want to gain from this? You know what I'm saying? What are your goals? Like, everything about them. And she handles the clinical side, and I handle the side over here where I need to know, do we need to get you services? We have a person that's going to start coming in July. She's going to be there 3 times a week for 2 hours, 2 to 3 hours on a volunteer basis. We're going to make her a little space for services where if the person doesn't have insurance, or they need SNAP benefits, or they need housing, or they need a sober home, or they need transit, we're going to have all these things, and we're going to help them navigate that part of their life too. I'm really excited about that. It's a little bit of growth that we're going to put over there. But they come in, and then from there, we come up with a plan, we come up with a medication plan, and we start treatment, and we start following their journey. As you know, some people have legal issues. We have to reach out to their probation, parole places, accommodate what they're wishing and stuff like that. But we just really wrap ourselves around, we call the patients, we call them after treatment, during their days where they don't come in. How are you feeling today? Or do we text them? We're always in contact. So again, it's a family over there. They come in, they're in this great space. I can't wait for you to come and see it.
Yeah, it's very nice.
Yeah, it's not a hospital setting. It's not like a corner for you. You're in like a living room, spacious, peaceful mind
like food
setting.
and coffee and stuff.
Yeah, we have a whole kitchen in there, coffee, water machines. Certain times of the day, we have snacks that come through, and the patients, they're just our family. They're really family to us. And they one person said to me the other day, I can't wait when it's my turn to come. I can't wait to get there. I feel so good when I leave here, not just because my treatment is over, but the love. We have a medical assistant, Noelia. She's amazing with our people, and they love her. And it's just a different setting. We have dogs. The dogs come in a couple days a week, and they go from chair to chair. And
what are they, therapy dogs?
Yeah, they're my little dog.
Yeah.
Yorkie poops, right?
I love that.
And they sit on the patient's lap, and they wait. They look for them. Where are the dogs today? Where are the dogs?
Yeah.
And the dogs are trained that if they're not invited, they don't jump on the patient's lap. Like, you don't get up on nobody's lap unless you're invited. So they'll sit by the end of the chair, and they'll look up at them. And every one of them will say, come up. And they'll get up, and they get pet all day long when they do come in, and they go from... And what's really nice about the dogs is they don't stay with one person. So they'll stay there 10 or 15 minutes, they'll jump down, and then they'll go ahead over to somebody else and get up with them. So they have a liking for everybody, and they all love them too. So, you know, and it's just a different atmosphere. It's not that hospital, go behind a curtain, get treated, and get
Well,
pushed out.
that's how
onto the
Redemption
street.
House was. Remember how it felt like a home.
Yeah.
And a lot
Yeah.
of people used to come there, and they were like, I don't want to. Can I just do my treatment here?
Right.
You know. So
Yeah.
that's awesome.
Yeah.
That's awesome. So I know I've already asked you this question. What have you learned the most about yourself? What have you learned the most about working with people in this field?
What I've learned about myself the most is that I'm a survivor, and no matter what, I can get through a lot of
You're a
stuff.
woman of faith?
Absolutely.
Yeah.
And I can get through anything I put my mind to, and that I'm going to embrace my passion. And the thing that I learned about working with people in this community is they can be just as successful, and they can have whatever they want to have, and we can help them. They just have to be committed. They gotta want it for them. So I take those things, and what God has for you, He has for you. That's it. Can nobody take that away unless you allow it to be taken away.
Mm.
And that's where I am.
Yeah. So what's next?
What's next? Work with Rick more.
Okay.
Work with Rick more,
Let's make it happen.
and connect and continue to reach out to the community and let them know that we are here for them. And
You need to open a center down here, because if you did, I got 5, 6, 7 houses waiting to show up at your place. And
you know,
you know what I mean?
I know. I want to expand. I have been in the talks with somebody. I know. I know. I we could talk about that.
Yeah.
I'm in talks with another practitioner that lives in this area.
Mm-hmm.
That is interested in doing something down here with me. And I'm excited for that growth to happen.
Yeah.
And I see it. When I first opened the center, and as we started rolling, I really knew that I wanted to hit every major city. I wanted to be in Hartford. I wanted to be in the New Haven area, the Bridgeport area, the Waterbury area, because that covers everything, right? So you get them coming and going. So, I pray that comes into fruition for me. And but again, God knows where He'll lead me next. But I definitely 2 days ago had a conversation with another practitioner regarding a center in this area.
No, how about that's business? What about personal? Where do you see yourself in 5 years personally? How many more grandkids?
Well, my daughter got engaged about a month and a half ago. So she's going to be getting married in Italy next September. So I'm really super excited and hoping that we'll have 5 years. Let's see, maybe 2 more. Because I don't know about the boys yet. They're kind of still searching for that special somebody. And I'm okay with that. No rush.
Yeah.
No rush. So, 5 years, I'd like to see at least 2 more centers, here in, whether it be Hartford or Bridgeport. Just in enjoying life and continuing to be on this road that God has put forth for me. That's really where I see myself. I don't ever see myself fully retiring. I don't ever see myself like laying out on a beach for life, like that. I don't think that's my
Maybe
purpose.
some of the time.
Yeah, maybe sometimes, but I tried that. Remember, Rick? I tried that. Moved over by the beach, retired, and it just wasn't for me.
No,
Keep going.
I don't see you retiring.
Yeah, no. Yeah, no.
But I see you. I see you very happy. I could see the fulfillment in your eyes, in your face. You smile a lot more.
Oh yeah.
Before, you used to be a little rough around in New York.
I know, a little rough, right?
They used to walk when you were walking up the driveway. They used to say, "Oh shit, here comes Anna. Don't fuck with her."
Right.
She's from Brooklyn.
Right.
but
we're from
no.
the Bronx.
The Bronx.
What,
All right, well,
we're from the Bronx.
It's all the same.
I'm from
They
the
all
Bronx.
all the Puerto Ricans from the Bronx look the same.
Not Puerto Rican though.
Oh,
Remember
I'm Dominican. No,
that?
you're
I'm not that.
Are
I'm
you
Italian. I'm a first generation.
Are you
My
really?
dad was born in Italy.
No
Yes.
shit. I'm
yes.
a half a wop, so
Okay, yeah, we're
I relate.
close. I'm full wop, like crazy wop.
Full wop, crazy wop.
Yeah,
but I
because-
bet you know how to cook, huh?
I do. That was always something I always said I wanted to do as a kid. Like, I want to work at a restaurant. That's not happening.
Yeah, restaurant. That's a tough business.
Yeah.
So it sounds like you're very fulfilled in what you're doing. Is this home base for the rest of your life? Like you're going to be doing this work for the rest of your life?
Yeah. Till God calls me home. So it's about it,
Did you ever watch? You ever watch The Sopranos?
I did. I didn't want to get into it too tough, but yeah.
All right. So there was. Remember the character Phil? His name was Philly. What was his name? Sil. So he was
silly.
He was the guy with the bouffant haircut.
Right. Yeah.
He was Tony's right hand man.
Right.
And there was a scene in Sopranos where
Did he get killed in the end?
he did.
Yeah.
He did. He got But that was a great show. That ended well. I love the way it ended. But there was a scene where he was like, just when I thought I was out, they pulled me back in. And I always think of that, like working with addicts, because it's like, oh, I should just sell New Beginning or whatever and go do, and it's like, what else am I going to do, man?
Yeah, but I would be heartbroken because, Rick, you're amazing at what you do, right? And your places are one of a kind. Like, who can I call in the middle of the night? Or who can I call and say, hey, you have 5 minutes? And you give me that attention, and you give that same attention to the people that come to you that need your help. So where would we be without you? Like listen, you're talking about me never retire? Rick, you can't retire.
No, I'm not
retiring.
retiring.
There ain't nobody else in the game like Rick.
No, but it's us. It's a group. I don't take credit, and I give all the glory to God because God chose me to run this amazing organization and to work with amazing people like you and
purpose.
Yeah, we're definitely.
It's like our purpose.
Yeah.
They say you never know what God's purpose is for you, or you're not revealed.
Well,
but
if you think
if you sit back and put your head back, you can really see what God's purpose for you because your passion is where that lies. I think my purpose is just to help the community, keep helping the community, keep people in recovery, see more success than death.
Yeah.
That's
yeah. So we're gonna work together. We're gonna come visit your center.
Yes, we'd love to have you.
And let's collaborate.
I'll get you some lunch if you come.
Oh yeah.
Yeah, I'll buy you lunch.
Crab legs.
We do have a great.
Shing Shing's the one who makes sure I get to all my appointments and my schedule.
I could tell because she's the one that texts, and I'm glad that she's amazing.
She's beautiful, amazing. She's funny. She's smart. Yeah. I'm very blessed.
Yeah, we need some of her help too, so I'm gonna collaborate with her too,
Yeah,
if you don't mind. With me,
Listen, I'm all about growth in the entrepreneur world because we're all entrepreneurs. I'm an entrepreneur. I can't work for anybody. I love working for myself. I love to be able to do what I want to do because I know if I could do what I wanted to do, and especially if I could get some funding, like I can do amazing things, help so many people, link them up with places like yours, and not the methadone. Get off the methadone. Get off all the prescription meds. You know what I mean?
I have somebody that came to me yesterday. They've been on methadone for 5 years.
That's it?
5 years. I know, but for him, 5 years, no relapses, doing well, but he realizes that he really needs a healthier option, and then to really expand his recovery to take care of his mental health too. Yeah. And that was amazing. And he started treatment this morning before I left to come here. I'm super excited for him, and we're working on his calculations to start tapering off the methadone. So super excited for that.
But I love to hear that. Like he's been on methadone for 5 years, and he wants to do something else. But he's a success story, and there are some success stories out there. Mm-hmm. But I think if they tweak the program a little bit and maybe had an exit plan with a recovery plan, I think methadone could be a very effective tool.
Right.
You know what I mean?
think a short-term methadone transition them to a view to get them fully stable, taking care of their mental health, get them stable all the way around the block, get them therapy. They need talk therapy. They need peer-to-peer support. They're living in communities, sober homes, where they're getting peer-to-peer support.
Good sober homes.
Yeah.
You know.
Say that. Good sober homes.
Yeah.
You know, where they're getting the support and the knowledge, and they could be successful. I want to see more success. I want to see less death.
All right.
And you know, you ever scroll through Facebook and you look at the town things?
Yeah.
And you say overdose over here, overdose over here, overdose. That's so sad.
Yeah.
I just want to stop. I just want it to stop.
But it seems like it's slowing down a little bit because
a little bit, yeah.
a lot more people are popping up.
Yep.
So
Thanks
listen,
for having me today.
we're almost out of time, right? And I love the podcast because people come in, they don't know what's going to happen. What am I going to say? And it just ends up being an amazing conversation. They sit there and they smile, and now it's almost over. But I always ask this question: what would you say to somebody that walked in your center and they got like 30 days clean and nothing's going right for them, and they're like, Anna, I'm done. I'm just going to go get high.
Not today. Not today.
Not
it doesn't
today.
end. It's not going to end today. You're 30 days clean. We're going to keep going. We got something for you. Let's see.
All right, we're going to have you sign the wall. I want you to write that, not today. That's Anna's logo, right? That's her mantra, not today. All right, folks, listen, this has been a great episode. Anna, I love you. So freaking proud of you. I know your mom is. Congrats on the granddaughter. You got a lot of amazing stuff going on in your life.
do.
You really do. We need some of that energy, right, babe? We need some of that energy.
Blessed
So
and highly
we're definitely gonna connect and do some big things and help a lot more people.
Great.
You know?
I'm excited.
And so as always, we do this podcast to raise awareness for Redemption House and let people know about amazing resources that are out there. And if you have a loved one or it's you that's really wants a change in your life and you're really motivated to change, please call me 203-909-5707. And Xing Xing, how does one get a hold of us?
You can get on our website, newbeginningrecovery.org, or you can find us on social media, TikTok, Facebook, Instagram, on the New Beginning Recovery Houses.
Anna, go.
Yes, you can get us Peaceful Minds Treatment Center, PMT Center.com. You can email us at pmtreatment@gmail.com. You could call us at 203-475-68. I'm crying so much. I had such a good time with you. 689-3381 or 203-800-1642, 24 hours a day, text or call line.
Awesome. Share the show.
Thank you, Anna.
That was great. That was a great